Viewers, in this video, we are going to discuss about evidence-based approach in community health nursing. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. Objectives of this video are define evidence-based nursing, explain the need for evidence-based practice, enumerate the various models in evidence-based practice, and enlist what all the barriers we are encountering while practicing the evidence-based practice. List down the advantages of evidence-based practice. Evidence-based practice. First, we will see the introduction. What is evidence-based practice? It is a problem-solving approach. What is the purpose? To deliver the healthcare that integrate the best evidence from the studies and the patient care data with clinical expertise and patient preference and the values. Because while delivering the healthcare services to the huge population, we are facing so many problems and the issue. To minimize that, we are practicing this evidence-based practice. Okay, evidence-based practice is the integration of clinical expertise, patient values, and the best research evidence into the decision-making process for patient care. Clinical expertise refers to the clinician cumulated experience and the education and the clinical skills. Based on this, we are formulating the roles and responsibility. We are formulating the best practices for delivering the healthcare services. Evidence-based practice is the process of making them clinical decisions, okay, based upon the evidence, it combined with the clinical experience and the patient expectation. This is the definition of evidence-based practice. Evidence-based practice is the process of making the clinical decisions. Okay, how they are making the clinical decision based upon the evidence. It usually combined with the clinical experience and the patient expectation. Evidence-based practice is the conscientious, explicit, and judicious use of current best evidence in making the decision. The practice of evidence-based medicine means integrating the individual clinical expertise with the best available external clinical evidence from the systematic research. This definition is given by Scattel et al. In the year 1996. Aims in evidence-based practice. It provides the high quality and most case efficient nursing care as possible with the help of this evidence-based practice, and to advance the quality of care provided by the healthcare worker, to increase the satisfaction among the patient, to focus on nursing practice away from the habits and the tradition to the evidence and the research. It results in better patient outcome. It contributes to the science of nursing. It keeps practice the current and relevant information. It increases the confidence in decision making. Next, we are going to discuss about objectives and purpose of evidence-based practice. Evidence-based practice seeks to replace the practice as usual what we are practicing. Okay, and guided by the rigorous outcome-oriented research idea. Less subjective expertise and to rise it to the higher level of accountability. It reduces the variation in nursing care. It assists with the efficient and the effective decision making, providing practice to the nurse evidence-based data to deliver the effective care. These are all the objectives of evidence-based practice. Next, need for evidence-based practice. For making sure that each client getting the best possible services and update the knowledge, and it is essential for lifelong learning. It provides the clinical judgment. It improves the care provider and it saves the life. To provide framework for understanding the evidence-based practice process. Steps in evidence-based practice. Mainly there are 4 things out there. that we used to call as PICO, PICO. P for the patient population of interest, the common interest of that particular area population. Okay. I for intervention of interest or range of intervention. Okay. Example, exposure and the risk behavior. How far the people are doing that activity. Exposure and risk behavior. C for comparison of intervention. Example, number of intervention. For example, in that particular area, hypertension is common means how far the people in that particular area following the remedies, whether they are what kind of intervention is suitable for that particular area. For example, dietary modification is suitable for that particular area group or exercise pattern. Okay, comparison of intervention. O for outcome of interest, accuracy of diagnosis, risk of disease. So P for the patient population of interest, I for intervention of interest or range of intervention, C comparison of intervention, O for outcome of interest. Okay. Next we will discuss model for evidence-based practice. Okay. Basically, three models are there. Okay. The Stelter model and IOWA model, Rosebaum and Lama P model. Three models. It's a basic model are there in evidence-based practice. Okay, first we will discuss about Stelter model. It was developed as a practitioner-oriented model in the year 1994 and it was revised in the year 2001 without much changes, but it focused on the critical thinking. It raised awareness about the importance of applying research finding in the nursing practice. Based on this model, evidence means information or fact that are obtained systematically from the research. Usually the evidence comes from two different sources based on this model. One is external evidence and second is internal evidence. What is external evidence? External evidence means the information shared by the expert by their own experience, the information given by the expert that we call as external evidence. The second one is internal evidence, means comes from the systematically obtained fact or the information at the ground level. Next, phases of Stelter model. 5 phases are there. First one is preparation phase. Second one is validation phase. Third, comparative evaluation decision making. And fourth one is translation application phase. The fifth one is evaluation phase. Okay, the next model is IOWA model. It was implemented in the year 1994 internationally. It infuses the research into practice and improve the quality of care. This model developed by Marita Tetler and a team at the University of IOWA Hospital and the clinic. It utilized the multidisciplinary team approach. The main highlight of this model, it incorporates the use of research and other form of evidence. In this IOWA model, it linked to the quality of assurance and it given recognition for research work. Clinicians are given time and resources for doing research work. In this model, they explaining about how the organization changes the practice based on the research finding, and it gives a systematic design for doing research, and it includes both the practitioner and the organizational perceptors for taking decision. It provides guide for implementation of evidence-based practice. These are all the benefits of following the IOWA model. The third model is Rosebaum and Larrabee model. It was developed by Rosebaum and Larrabee in the year 1999. It is based on theoretical and research literature. It begins with the assessment of need and integration of an evidence-based protocol. It focuses on the use of change in the theory, principles of research, and standardization in nursing nomenclature. Next, stages of Rosenbaum and Larrabee model. In this, totally 6 stages are there. First one, assessment of need for change in the practice. Second one, link the problem with the intervention and the expected outcome. Third one, synthesis the best evidence. Fourth, design a change in the practice. Fifth one, implement and evaluate the change in practice, including the outcome evaluation. Last one, integrate and maintain the possible change in the practice. We know about the importance of evidence-based practice, but in practicing this, we are encountering so many barriers. Lack of value for research and practice, and difficulty in bringing the change among the organization, lack of administrative support, sometimes lack of knowledge for the people to do the research, and lack of time for doing the research. Many nurses have not received any formal instruction in research, and they lack the skill to judge the merits and the demerits of the study. Unavailability of research reports which are not easily gathered because of complexity of the research regarding the evidence-based practice, or organization have failed to motivate or giving rewards to the subordinate for doing research. There is a shortage of role model nurses who can be evaluated for their success in using and promoting the use of research in clinical practice. Now we will see the advantages of evidence-based practice. It provides better patient outcome, and it increases the efficiency of the nurses, making decisions based on the knowledge that is backed by research. It keeps nursing practice current to the new trend and updated guidelines of the care. It provides variation in the practice because it can help determine the high quality care, cost effective intervention that actually work, and it promotes high quality and cost effective intervention and treatment. Using evidence based practice, we are able to provide care to the patient, and also it increases the confidence level among the nurses. It is needed. Evidence-based practice is needed because keep on changes take place. So many technological advancement takes place. The human attitudes towards the health behavior, lifestyle modification, so many changes take place nowadays. So keep on, we should do the research and we should bring the evidence so that very confidently be able to give the nursing care. So these are all the advantages of evidence-based practice. To summarize, in this discussion, we have discussed about what is evidence-based practice, why we need to follow, and what are all the steps in that, and models we have seen. We have discussed about mainly the 3 models, and what are all the barriers and what are all the advantages of evidence-based practice. Thank you viewers for your support. Bye bye.